Hi, welcome to the Brown Bag Lunch Training Series from Family Voices of California. This is a training series on health and policy topics affecting children and youth with special health care needs. Our presentations are geared towards a variety of people, families, professionals, parent-to-parent staff, youth, advocacy organizations, state departments, and anyone else who's interested in our topics. Today's topic is on the Lanterman Act, Your Services and Supports, Change in the Law, with Katy Lusson from the Office of Clients' Rights Advocacy, Disability Rights, California. Before we start, I just want to give a few notes about the technology. There are a few ways to participate on today's call. And unless you have a headset with a microphone that allows you to speak through your computer, you'll either need to call in or type in your questions. You could find the call-in number from the confirmation email, or while you're connected, you can go to the audio menu, select Use Telephone, and it'll give you a dial-in number with code and audio pin. And if you have any technical difficulties, you can contact GoToWebinar, or you can send me a chat. And owing to feedback issues and the fact that we have a lot of people on the call today, we're going to have everybody on mute until it's time for questions. So when you have a question, you can either type it in, write it down for yourself to ask later, and when it's time for questions, what we'll do is you'll push the little hand icon with the arrow to let us know that you want to talk, and then we'll get to you in the queue. And there will be opportunities for questions, and after today's presentation we will be emailing out the PowerPoint slides to everyone. And with that, I'm going to go ahead and turn it over to Katy. Thanks so much for joining us today.
Hi, this is Katy Lusson. I'm an attorney with Disability Rights California, the Office of Clients' Rights Advocacy, and my particular office works with consumers of regional center services. The PowerPoint is the Lanterman Act, Your Services and Supports, the changes in the law. And the Lanterman Act is the part of the Welfare and Institution Code that explains how the services and supports will be provided for people with developmental disabilities. So in 2009, last summer, when the legislature voted in massive changes to the Lanterman Act, and known as trailer bills. And what's important to know about that is that they weren't budgetary changes, they were actually changes to the law. So they're not just in effect for a year. They're not one budget year. They're actual changes to the law. So I'm going to go over the primary changes, and I'll do one area, and then I'll ask for questions on that area. That'll make it easier. So what is the good news? Well, there isn't a lot of good news, but the good news is that there were not changes in eligibility for regional center services except for early start, and we'll go through that. There were not changes in the IPP process, which is the individual program plan, and that's basically the contract between the consumer of services and the regional center that sets in motion the services and supports that people receive. And there were no changes to people's appeal rights. In other words, people still have the right to appeal decisions on the parts of regional centers and to have their day to be heard. So now I'm going to start going through specific changes. A very large change and very important change was that respite is now mandated to not exceed 90 hours every 3 months unless somebody meets an exception. Previously, the regional center had guidelines, but they weren't mandated, and if somebody needed more, they just simply had to have a meeting and describe what they needed. Now they have to prove that they fit into one of these two exceptions. One, that extra time is needed to keep a person in their home, or two, that there are extraordinary needs in the family, circumstances in the family that necessitates extra time. And this PowerPoint, why it says you, is because this PowerPoint was originally intended for regional center consumers. So statewide, there have been decisions all over the board on the parts of the administrative law judges and on the parts of the regional centers. So it's really hard to say what constitutes extra time that's necessary to keep someone in their home, or what family circumstance is needed. I can tell you my own experience is that the people who have gotten exemptions have people who require an extraordinary amount of care because of their physical or emotional or behavioral needs, and that the family would really have to look for placement outside the home without the respite. On the second one, that the family needs extra time, it really is that there is a family circumstance that at this time demands extra time. In other words, one family where the mother was just had surgery and they gave extra hours. So are there questions about the respite before we go on?
Okay, so if you have questions about respite right now, go ahead and raise your hand or type in a question. Okay, I have a hand raised with Sherry. I'm going to try to unmute you. Let's see if we can hear you. Sherry, you there? Hi, Sherry, you there? Okay, Sherry, if you go ahead and type in your question. Let's do it that way. Let's see, I'm not seeing other hands raised right now for respite. Oh, let's see here. Sherry typed in her question. Oh, she just said she doesn't have a mic. Okay, so let's go ahead and move on. And if there are questions that come in about respite, I will let you know.
So there's also an expanded scope of duties for in-home respite workers. Now in-home respite workers can perform more tasks than they were previously able to under the law. So they can do colostomy and ileostomy, cleaning, changing bags, changing and emptying bags at the catheter site, and feeding, hydration, and cleaning Stroman adding medication to gastrotomy. So those are the main changes. We haven't seen across the state very many problems with this particular change. So people still have rights. So again, I'll say that this PowerPoint was meant specifically for people who are consumers of regional center services. So people still have the right to file a hearing request. If they file that request within 10 days of receiving their notice of action that the service is going to be changed, then they get what's called aid paid pending. And that means that the service will continue until the dispute is resolved. Otherwise, they have 30 days still to file an appeal. What's also important to add is that if a regional center wants to change, alter, or terminate a service, then they're obligated to send out a notice of action. That's an official notice of action and includes an appeal form on it. So there are several new program options that were also included in these trailer bills. The first is the individual choice budget, which has not yet been implemented, so we don't have very much to say about it. And what it'll mean is that people will get a finite amount of money, and then they will be able to organize their own services. So in other words, if they wanted to purchase more of a service that's been otherwise terminated, they would be able to do that. Again, it hasn't been implemented, and I know this slide says look for it in 2010, but we don't have any idea when it really is going to be implemented. Then there's this custom endeavors option, which is a day program alternative where people would be able to do volunteer activities or other things. I have not had a single case of anyone who has chosen that option. And then there was an option put in for seniors, well, basically people over 50 years of age, where each service provider, in other words, everyday program, must offer this option, and the staff ratio is 1:8. The problem with this, basically, is that there are already, at least in the Bay Area, and I know in the southern part of the state also, there are specific senior programs where the staff ratio is already higher than 1:8. It's better. So, you know, most people that are in a senior program wouldn't opt to go into another senior program. So I have also not seen this. Does anybody have any questions on these program options?
Okay, and we had some come in also related to respite.
Okay.
So Sherry said, I've been told that you only have 51 hours and not 90. Is that true?
No, that is not true. The law is, the trailer bill is very specific that that the high point is 90 hours per quarter or 30 hours per month. A particular regional center may tell someone that they, because of their circumstances, are only entitled to 50 hours, but the law says that up to 90 hours is what's allowed.
Okay. Let's see. We have a question from Joan Crick. Joan, I'm going to unmute you so you can ask your question. Joan, are you there?
On telephone only.
Oh, Joan?
Hello?
Hi.
Hi. Yeah, I had a question. The extra tasks that the respite workers are expected to do, does Regional Center have any plans for training for these extra responsibilities?
Not that I know of.
No? Okay.
No, I haven't. That's a great question, and I have not heard of any plan to do any training around those additional tasks.
Okay, thank you.
You're welcome.
Thanks. Okay, we have a question from Lori. She says, are IHSS workers and in-home respite workers the same?
No, they're not the same. IHSS is a service provided for basically Medi-Cal recipients. It's linked to qualifying for SSI and Medi-Cal, and it's part of the Department of Social Services or the Department of Health Services. Respite is a regional center service that's provided by mostly someone that the parent finds. Also, IHSS provides a service that comes in and performs certain tasks for a person: cleaning, shopping, cooking. Respite is designed to give the primary caregiver a break, basically, respite from the care of the person. So they're not the same. They're not the same service. They don't come through the same, funding channels, and they have different. They're for different kinds of things. Although I'll go later on. I'll talk a little bit about there is now some ability of the regional center to ask about IHSS services and whether they indeed do fulfill the person's IPP, their individual program plan in terms of respite. But I'll save that for a little later.
Okay. There have been a number of questions about the custom endeavors option. A number of people say, could you explain it a little bit more? They're not sure what it is.
Well, neither am I, because nobody I know has chosen it. I haven't heard throughout the state, I haven't heard of anybody choosing it. But basically what it is that instead of going to a day program, a regional center consumer would choose to spend 20 to 80 hours per month either doing a volunteer activity or developing some kind of employment, or we're not exactly sure what, that would be offered by service providers, that may be attached to a day program. But instead of going to a day program, this would be more an individualized type of a program. Again, I don't know anybody. I haven't heard any of the other clients' rights advocates or anybody in DRC talk about anybody that they know that's made this choice. So I can't say much more about it.
Okay. We have a question from Riva. Riva, I'm going to try to unmute you. 1 second. Let me just find you in the list. Here you are. Okay. Riva, are you there? Not sure we can hear you. Not Riva? No. Okay. So she says our local regional center has a committee that reviews respite. Is that across the state?
No. Each regional center handles it differently. I don't know, when you say a committee, you they may be calling it a team. Usually a person will make a request to their regional center service coordinator or case manager, whatever they call them, at that particular regional center, and then that case manager will probably review it with the team to determine whether or not that person meets an exemption. I just need to say again, I do not work for the regional center. I work for Disability Rights California, so I don't know all of the internal policies of the regional center. I know how my regional, the regional center that I work with does it, but I assume that each regional center may do it a little bit differently.
Okay. Estrelita had a question about some services. Let's see if we can hear her. Estrelita, are you there? Okay. She wrote her question. She said, do you know if the regional centers are reducing services such as independent skills training? My son is 20, and these services are very helpful for him.
It would depend on what it is particularly. There's not any specific trailer bill that has to do with ILS services, but there are for supported living services. So, they're not mandated to reduce them, but I'm sure that regional centers are trying to save money wherever they can. So I think what's important to remember is that if your son doesn't agree with the changes, that he has the right to appeal that decision.
Okay. Let's see, Joan. Okay, Joan, do you want to ask your question? Go ahead.
Yeah, thank you. There's a lot of confusion between respite and IHSS, and you explained it very clearly, and I understand that. Is there anything in writing that explains it so that if a case manager says to a client, oh, they're the same thing, that we could point out
Right.
the differences?
Yeah. If you go to disabilityrightsca.org, there are publications and there's news about the changes in the law, and there are fact sheets on all of the budget cuts, all of the trailer bills, and there's one on in-home support services and one on respite, and those would be very helpful.
Okay, great. Thank you very much.
Sure.
Okay. Okay, let's take one more for this section and then keep moving. I have Catherine Mosley. Catherine, I'm unmuting you. Go ahead.
Okay, I just wanted to know if an individual can have both services at the same time.
IHSS and respite?
Yes.
Definitely.
Okay, great. Thank you.
Okay.
We're going to get to respite, so I'm going to move on now.
Yes, go ahead.
So that we can get there. Another big area of change in the trailer bill is around supported living services. First of all, the trailer bill says that all of the available and natural generic supports must be used, and that vendor costs must be reasonable and cost-effective. And some regional centers, very few regional centers, were allowing, in very limited circumstances, rent or mortgage or lease payments to be paid by the regional center or an organization. In this area, it's West Bay Housing, for supported living, for consumers who are in supported living and have extraordinary needs. And that's been eliminated except in very, very, very limited services. One change that's been really significant is that roommates must share the same supported living vendor as long as their IPP goals are met, as long as their individual program plan goals are met. Very often, if 3 people share an apartment, they're all receiving supported living services, but they're not all receiving them from the same agency. So now they must share the same vendor as long as their IPP goals are met. In other words, if one person had very serious behavioral needs and was served by a agency that specialized in serving people with behavioral needs, then that would probably not meet their IPP goals. Well, otherwise, they should, and actually that makes more sense anyway. So nobody's had a big objection to that one. It really does make sense unless someone has extraordinary needs. And then the other thing is that supported living, person who's in supported living now must apply for in-home support services within 5 days of moving into their supported living situation, unless they can clearly show that they wouldn't meet the criteria for in-home support services for IHSS, and that would you know, their income was so enormous or whatever that they just weren't going to meet the criteria. Everyone else is obliged to apply for IHSS. And I know that most of the supported living agencies in this area have been applying for people as soon as they're moving into a supported living home. So what I'd like to do is just talk a little bit now about how that IHSS works for supported living, and then I'll ask for more questions. And that is, the person needs to ask whether or not they qualify for in-home support services, and have they applied. If they just decide that they don't want to apply for IHSS services and they're receiving supported living services, they're probably going to be in a little bit of trouble, because really the law does say that they must apply within 5 days. And then if there's a gap between when the IHSS comes out and does the assessment and the hours are put into place, and someone hired to provide the IHSS, the person can ask the regional center for what's called gap funding, and that means that the regional center will pay for those services until the IHSS is in place. And as I said already, the extraordinary circumstances that would qualify for an exemption is that somebody can just show that they clearly wouldn't meet the income criteria for SSI or Medi-Cal or you know, and therefore IHSS. So, are there questions about supported living services?
Okay, let's see. I have a few questions here. There was one from actually the earlier section. She said, Marlena wants to know, are nursing services affected now that respite providers can provide some medical assistance?
Well, I'm not sure how to answer. I mean, that people that are respite workers can provide the additional services that we talked about, but I'm not sure if that's what I mean, those are not necessarily nursing services. They're services that respite workers were not able to perform previously, but I don't necessarily think that meant that you know, a nurse had to perform them.
Okay. We have a question from Rhonda. Rhonda, I'm going to go ahead and unmute you so you can ask your question. Are you there, Rhonda?
Yeah, I have no mic.
Oh no, we can hear you.
Can you hear me?
Yep, we can hear you.
Oh, okay. You want me to just ask you my question?
Go ahead and ask. Yeah, go ahead and ask your question.
Okay, my name is Rhonda, and my son lives with higher functioning autism. He has a functional index score of less than 2. He will be independent in a couple of years. He's 16, and I have an awesome support system for him that he will be able to take over. But my concern is he at risk of losing his services because of his index score? I mean, are they really going to cut services? I'm willing to start a riot. Anyway.
Okay, that would be another entire training.
Okay.
Right now, Disability Rights California and other organizations have filed lawsuits objecting to the use of functionals, the index scores and the functional scores for determining whether or not somebody qualifies. It's been, all of those changes have been stayed. You know, there have been in court. IHSS is definitely, they are going to be making changes. What those changes are going to look like and you know, how they're going to do it, I think is dependent on the outcome of these lawsuits that are floating through the courts right now. I think the most important thing to remember about it is that if you get a notice of action about in-home support services, you have to apply for aid paid pending. You have to appeal it and apply for aid paid pending, because that way the IHSS services will be continued until the issue is resolved, and these offices are going to have a huge backlog of appeals. So, you know, that'll give you some time.
Okay, you said an appeal, and what was the other thing you said that I needed to get or do?
Well, when you should apply for the appeal as soon as possible, within 10 days, and ask for aid paid pending.
Aid
pending. Which
Okay.
means that the service will continue until the dispute has been resolved.
Okay.
Okay?
Thank you. And
Sure.
thank you very much for doing these.
Thanks,
Sure.
Rhonda. Okay, we have a question from Trudy. She said that she's been asked if IHSS is eliminated or reduced significantly, that regional centers will fill the gap for lost hours from IHSS. Has there been discussion about this?
Yeah, but you know, that's not that's not practical, because the only way that IHSS is a very specific service. The regional center doesn't really have commensurate service in a sense, and the regional center is going to run out of money. They're limiting all of their services. So, I mean, you know, I think that somebody could definitely ask, but, you know, I think that because IHSS and respite are, under most circumstances, different services, you know, that's going to be a difficult fight. You know, IHSS isn't actually in this particular training, but let me just say very generally, I mean, we could do another whole one on IHSS, but I'm just going to say generally how IHSS and the regional centers are now linked in a way that they previously have not been under these trailer bills. The law now, it's not so much a change again as a mandate. So unless somebody meets an exemption, the regional center now cannot pay for services that are available through the county's IHSS program. If somebody meets the criteria to receive IHSS, but they decline to apply for it. So that's different than the question that was just asked. That's when somebody says, I won't apply, I don't want IHSS, I'm not applying for those services. Then the other big thing, and this is where all of the confusion all over the state has come about. Regional centers are required to use generic services to meet your needs before the regional center purchases services. IHSS is a generic service, and therefore the regional center cannot purchase supported living services or other services like respite to replace IHSS. And some regional centers have interpreted that to mean that if somebody has a huge amount of IHSS services, in other words, if they have protective supervision and they're getting 283 hours, that and a family member is the provider, that they should find someone else to do it, and then they would be able to use that time for respite. That is not what the law says. You know, it has to meet, the IHSS would have to meet the objectives of respite respite in the person's IPP, in other words, to allow for that to happen. So I know all over the state, regional centers are cutting people's, specifically respite and then some supported living services, because they're getting, especially around protective supervision and IHSS. If that happens, then you need to appeal that within 10 days so that the service isn't discontinued that they're cutting. And then it's very, very case specific, how the analysis would go. So I'll ask for questions, but I know from the past that this could take another hour and a half just to answer the questions. So just saying that, let's see if there are questions.
Okay, there are a few other questions. One from Janelle. Janelle, I'm going to try to unmute you. You there, Janelle?
Hi, hello.
Hi.
I was just curious what the qualifications for IHSS and or Medi-Cal are in regards to autism or mental retardation.
Oh, you know, there are financial and medical criteria, and I can't go into that in this training. If you can call Medi-Cal, or well, the place to start would probably be Medi-Cal, and they can tell you what the criteria is, or ask for an assessment, but that's way beyond the scope of this training.
Okay, thank you.
You're welcome.
Thanks. Someone asks, what about gap funding after IHSS is in place?
Well, then there's no gap, theoretically. The gap funding is from when the person applies for the IHSS and when it is in place. So after it's in place, there's not a gap under the law.
Okay. And let's do one more and then move on.
Okay.
Sid asks, in the case of SLS, what is the definition of natural generic supports?
Well, that would differ from person to person. Also, it might be family members, it might be friends, it might be IHSS. It could be a variety of who supports that person. In other words, who is in that person's circle of support, basically. So a generic, IHSS would be considered a generic support, but so would a family member that comes over 4 times a week and cooks dinner or does laundry or cleans the house for the person.
Okay. Well, yeah, why don't we go ahead and move on, and then we can get to other questions later.
So another area that has been impacted is transportation. And that is that adults must use available public transportation if it can be safely accessed and utilized. And regional centers must fund the least expensive transportation that meets the individual's needs as set forth in their IPP. And for minor children living with their parents, transportation is going to be funded only if the family is unable to provide that transportation, and the parents must provide the reasons in writing. So for adults, what that means is that if the adults are taking a van or to their day program, but they could be safely trained to utilize public transportation, then that needs to happen. And that if there are two means of transportation, then the regional center must fund the least expensive. In other words, it can't pay for a taxi cab if there's a van or a public bus that the person could take. Again, it has to meet the needs in the IPP. And then for minor children, the transportation is only funded if the parent is unable to provide it. And the way how that's come up is for preschool, kids whose families have been typically taking them to their program and picking them up, and then can't do that anymore, and they need to go in a little yellow bus or whatever, that the regional center only paid for that if the family can't provide it. It's come up with doctor's appointments and where there isn't, ready wheels, or because it's a rural area or something like that. So that's another area that's been impacted. If there aren't questions about that, I'll go on. Let's just see, because I think we're getting, yeah, okay.
We have one question about IHSS. She said, Riva says, I've never heard of IHSS as a generic support. If it is increased, does the regional center look at that as generic support?
Yeah, it's a generic service. A generic service simply means the regional center is paying for it. It's being paid for or provided by some other agency. So IHSS is definitely considered a generic support. The regional center now has, under the law, the right to see if the IHSS does provide the same service, and that would usually be either SLS or respite, as the service that they're providing. Most of the cases that we've brought to hearing, the judges have agreed that that is not the case, that they're different services. So, but it is something that the regional center can now look at in terms of seeing whether it meets the individual's needs in the IPP.
Sherry says that my daughter was denied protective supervision because there was a two-parent home. IHSS said that this was no longer offered to a two-parent home. Is that true? I did appeal, and I was called by IHSS to drop the appeal since there was a policy that was proven to disqualify my daughter. Should I apply again?
Well, I really, IHSS is very, very complicated, and if I start doing IHSS now, we're not going to be able to finish this. There was always IHSS, there were always regulations about IHSS for two-parent families, and those still apply, and there are exceptions to it. So IHSS also has absolutely no right to tell you to drop an appeal, whether or not there's a policy, and a policy is different than a regulation. A policy is just something that they write up. A regulation or a statute is something that's the law. And you have a right to challenge either a policy or the law if you have an exceptional circumstance. So I definitely, they definitely don't have the right to tell somebody to drop it, an appeal.
Okay.
Okay. Okay, behavioral services. And for people who may not be that familiar with regional center consumers and what they need is for children or adults that have very, very involved behaviors, regional center provides behavioral services, and that usually is somebody who goes to the person's home and works with the parents in helping them deal with the behaviors. The new standards for the purchase of behavioral services is that the service provider needs to use evidence-based practices, and that means that they have to be able to show that what they're doing, that that there is research and there are outcome studies, and that it's not just something that they thought of themselves and are using. And services must promote positive social behaviors and address issues with learning and social interaction. That's just how the goals are written and how the behavioral plan is written. Once the goals are achieved, the regional center may discontinue the services. So it's very important to question whether or not all of the child, in this case, behaviors have been addressed. And whether or not the goals have been achieved, because the regional center now is going to discontinue the services if they determine that the goals have been achieved. And then that goes back to the wording in the IPP and the individual program plan is very important. It's a contract, and how the goals are written, or if there's a behavior plan, how well it's written is going to really determine how long the services can be sustained. Is there anyone who has a question on that?
Okay, if you have a question, you can go ahead and raise your hand or type in a question. I have a hand. Marion, let's see if we can get you on the phone. Marion, you there? Hello, Marion? Marion, it doesn't seem like the audio is working, so you might want to type in your question instead. Here she goes. She said, I heard that floor time is no longer covered. Is that correct?
Well, I would say that regional centers are saying, I guess that claim would be that it's not evidence-based practice, but, there's years and years and years of research and evidence. So, if a regional center terminated that service, I would definitely appeal it. And, if for people who are parents or providers of regional center clients, each regional center has a client's rights advocate that is part of my organization, part of the Office of Clients' Rights Advocacy, and we're all assisting people with filling out appeal forms and getting together evidence packets and all of that. So, you can call your local client's rights advocate.
Okay. Any other questions?
Okay. I'm going to skip several of the next slides because they're very technical and I think they're not as that it's more significant to talk about suspended services. So if you move to slide 19, it says suspension of services. There's a difference between services that have been basically discontinued under the trailer bills and what is called suspended services. Services that are suspended, which are camping and associated travel, social recreational activities, which is huge, a huge area, educational services, and non-medical therapies such as art, dance, music, recreation, horseback riding, aquatic therapy, all of those are suspended until such time as either, I guess, there's money back in the California budget to pay for them, or until the individual choice model comes out and people can elect to use that format to get a sum of money to pay for what they need. So there are exceptions to this, but this has been an area where, again, there have been rulings that are all over the place, and there have been some good rulings and some really not so good rulings. You know, these hearings are all administrative through the Office of Administrative Hearings, and they're not binding. They're not precedent-setting or even binding on any other case. They're all particular to the case in point. So unless someone can prove that one of these activities that's suspended is primary or critical to the amelioration of the physical, cognitive, or psychosocial effects of the developmental disability, or they're necessary to enable the consumer to remain at home and there are no alternative services available, there are no exceptions to this. So every regional center has basically notified people that they're no longer going to receive camp, that they're not going to receive social recreational activities, and that they're not going to receive any of these medical, non-medical therapies. So I want to give some time in case there are questions on this, because it's a huge area. It affects a lot of people.
Okay, we have a question from Cindy Chang. Cindy, I'm going to unmute you. Go ahead, Cindy. Hi, Cindy, are you there? Okay. Cindy asks, what is the individual choice model?
The individual choice budget is what I spoke about in the beginning, and I've mentioned several times. It's a model where a person would receive basically a lump sum of money, and then they would be in charge of putting together what services or supports they need, but it would be a finite amount of money, and you know, when that's used up, you wouldn't have more money coming. So because the model is still being discussed and debated, and we don't have an individual choice model yet that is ready to be implemented, I can't say more about it because it only exists in theory at this point.
Okay. We have a hand raised from Lisa. Lisa, I'm going to try to unmute you and see if it works. Lisa, are you there? Okay, Lisa, I'm not sure your audio is working, so if you have a question, go ahead and type it in. Any other questions right now? Here's a question from Patty Moore. Patty, are you there? Seem to be having an audio problem, a few folks. Patty, go ahead and send your question in too. Okay, why don't you, oh, well, let me see, did I get, okay, I have a question about the individual choice model. Do you know if it will have tax consequences for the individual?
I don't know any more about it than what I've already said. It doesn't, it only exists in theory. I'm not a tax attorney, so I don't know what the tax consequences would be.
Okay. We don't have any other questions right now, so you go ahead.
Okay. I want to just talk for a minute then about experimental treatments, because experimental treatments, therapeutic services, or non-clinically proven treatments can no longer be provided. All treatments and services must be effective and safe, have known risks and complications, and are in the general practice. What each regional center considers experimental is up to that regional center. Some regional centers have, for example, been funding aquatic therapy or horseback riding, horseback therapy, horse therapy for years and years and years. There's a lot of research and outcome on it. Some regional centers still consider it experimental. So if you have a treatment or a service that's being provided that the regional center says they're no longer going to provide because it's experimental, you're entitled to a notice of action, and you can ask for a hearing. And then you need to collect your evidence. You need to get a letter from a doctor saying that, it's necessary for the person. You need to collect evidence like you would for anything else and go to hearing. And then there have been, again, rulings, that are all over, so that we've had some really good luck with getting some of these treatments approved. The court orders that the regional center has to pay for them, and then there have been other decisions that don't support those treatments. It's very individual, and it really depends on the particular regional center and the evidence that you have to provide. I'm not going to go into the general standards because that's not important. So basically, that's the end of what I want to present, and if there are more questions, I'm happy to take them.
Okay, I have a question from Lisa. She says, I have applied to appeal the termination of music therapy for my 10-year-old. What have been the basis for successful appeals? Do you know of any examples?
You can go on the website of the Office of Administrative Hearings, and you can look at DDS decisions, and you can put in music therapy, and you can pull all of the decisions that have to do with music therapy, and then you can read when the judges have sided with the regional center consumer, or when the judges have sided with the regional center. Basically, it's very individual, and somebody has to really prove that it's a very necessary. Let me go back a few. That it's a primary or critical means of ameliorating the physical, cognitive, or psychosocial effects of the developmental disability, and that it's necessary to enable the consumer to remain at home. So it's very individual, that you have a set of circumstances that would basically fit those exceptions.
Okay. Patty?
I really suggest, let me just say,
yeah, go ahead.
I really suggest, and it's very easy, to go to the Office of Administrative Hearings website, and if it's a regional center case, you look under DDS decisions, and then you just put in the words, for what you're looking for, and you pull up the decisions, and, read through. You don't have to go back very far, because the only cases that we're talking about basically have happened since, August or September. So, you'd only have to look at, several cases to start to get an idea of what kinds of things prevail. Okay.
Patty, are you there? Patty Moore?
Yes, I am.
There you are. Go ahead and ask your question.
Oh, okay. We're a language with regard to center staff, the comments services is, well, we can't do that anymore. Taylorville language. Most recently, nursing services were denied for a regional center client who happens to be a resident in subacute care hospital. And the only way he is allowed to even leave the hospital is with LDN support, and the center has denied state and support.
Well, I would definitely call the client's rights advocate at that regional center, and I would appeal that. I don't know why the nursing services were denied, and the person has the right to appeal it.
Okay, then we're on it. Thank you.
And also, if you've already run out of the appeal process, you know, if you are over the 30 days, then you just need to ask for the service again and get a new notice of action.
Will do. Thank you very much.
Sure.
Okay. Let's see. We have a question from Teresa. Teresa, I'm going to try to unmute you. Teresa, are you there?
Yes, I'm here.
Hi, Teresa. Go ahead and ask your question.
Yeah, I was wondering with the development of the individual choice model, are they going to be taking parent and or advocate input as far as addressing families that are in hard-to-reach locations, rural locations?
The individual choice model, to my understanding, there have been parents, service providers, heads of agencies. There have been many different people who have had input into this individual choice model, and then DDS needs to you know, finalize that and you know, present it. So there has been input from a variety of sources. If you have something that you want to talk about, you know, you could call DDS and you know, say that you want to talk to somebody about the proposed individual choice model.
Okay. Thank you very much.
Sure.
Okay. I had a hand from Karen. Karen.
Hello, this is Karen.
Karen, sorry.
Early in the program, you had said you were going to discuss the eligibility for early start, and I know that we're out of time, but you know, early start was really my main interest.
I can do it. I can make it very short and not at all sweet. You know, basically, early start. The changes are that in order to be eligible for early start now, you have to have an established risk condition or a developmental delay, which is very specific in terms of that delay, what that delay means. For children age 0 to 23, it's a significant delay at 33% in one or more areas. For children 24 to 36 months, it's a significant delay in 50% in one area or 33% in 2 or more areas. And then those children are eligible for early start. Everyone else, in other words, all of the high-risk children, all of those, you know, the preemies that aren't showing any developmental delays but were in there because they were at risk, those children are no longer eligible for regional center early start services. Though they are supposed to be, there are supposed to be the other programs that they're going to, prevention programs for these children who are, you know, at risk but not eligible for regional center services. So that's a huge hit, because it's all of those children that we've worked so hard to get the services so that they don't end up with a more severe delay. The legislature decided that those children didn't need these services, and they would just get these very limited prevention services.
Okay, thanks.
Thanks, Karen. Okay, I have a question from Krista Rose. She says she has a behavioral high-functioning autistic adult son who does benefit from standard behavioral services. And the type of therapy that she's been using is through their ILS provider who provides experiences, but they're not a behavioral therapist. And so with the regional center taking away social recreation, that means that their behavior modification is going away. Is there any way to keep hours for social recreation as it serves as a therapy?
Well, if it serves as a therapy and you can, you can show that it, that it's has a therapeutic value rather than, a recreational value, then yeah, you can appeal that decision, but you have to be able to show that that it's not just a social recreational, but it actually has some therapeutic or yeah, some therapeutic value.
Okay. We have one last question from Cindy. Cindy, let's see if we can unmute you. Cindy, are you there? Hello, Cindy? No, okay. She says, what do you do if the judge's decision was based on some inaccurate information?
Well, unless you can afford to go to the next level, which is state level court, you're stuck with that decision. That's why it's so important to prepare and to make sure that your case is, that you prepared your case well. Once the decision is rendered, there's not very much you can do unless you want to file a written, go to state court or the decision's not binding on any other case, but it is binding on itself.
Okay. So those are all the questions for today, and I want to thank everybody for joining us, and thanks so much to Katy. This was such a great webinar. And please, you'll receive a survey by email. Please fill it out. And if you have any follow-up questions, just let us know. You can look on our website at familyvoicesofca.org. There will be no brown bag lunch in March because that coincides with our annual health summit in Sacramento. And we're still accepting registrations for that. So if you're interested in coming, please sign up now. And our next brown bag lunch will be on the first Wednesday in April, and we'll welcome Susan Berger from the Department of Managed Healthcare. But thank you so much, Katy.
Thank you. It's been really fun.
Thanks a lot.
Bye-bye.
Bye.